All right, we should get started because you guys need to be somewhere at 10 o'clock then, right? For our skills.
Yeah.
Okay. Okay, so I have this music playing, and this link is in your Blackboard. And this song, I read a research article, and this song supposedly decreases your anxiety level by 65%. So, which, if you think about it, is a really good thing because if people learn to use non-pharmacological resources for decreasing anxiety, I think we would have a lot less people using benzodiazepines or misusing benzodiazepines if, we start learning different ways. So anyways, the link is Waitlist by Marconi Union, and the link is in Blackboard for you. So in case you ever feel like you need to listen to this before an exam or something, that might be a helpful thing before your skills check off. Might be a good thing. Okay, I am going to turn this off now. It's putting me to sleep and I need to wake up here. So, okay. Let's see. All right. All right, so we're talking about anxiety disorders. So it doesn't really say this specifically in the book, but we're all different as far as, again, everything's on a continuum. We're all different as far as our anxiety levels and what types of stress and things that we can tolerate. So does anybody like skydiving, roller coasters, jumping off a bungee or something? I don't know. Whatever you call bungee jumping, stuff that's really like exhilarating. Yeah, a couple of you are shaking your head? Okay, Andrea's shaking her head.
Roller
No.
coasters are okay, but skydiving is
I feel safe, but I don't know if I'd like bungee jumpers.
Nope.
Okay. You would?
Yeah.
Okay.
It would depend.
All right. Wow. Okay. Yeah, I've had a few students do like skydiving and things like that, and just like, I don't know. So we're all different. Katie, I didn't see you shake your head. Yes or no? You?
I don't like roller coasters.
Yeah, I don't either. I don't either. How about you? You don't like them either?
roller coasters, but I will not jump off anything.
Okay, so roller coasters, okay.
Unless it's on fire.
Gotcha.
Yeah.
I don't like roller coasters. I have been on them, and it is torture. For some people, like, they enjoy it. They're like, woohoo, thrill, and for me, it's torture. So I won't, at my age now, I am not going to do anything to make myself, like, get panic-stricken anymore. You know what I mean? I'm done with that. I did that already when I was young, and no, I'm not going on those anymore. I just remember that, what's it called at Disney World? Space Mountain. Anybody ever been on Space Mountain? Oh yeah, it was a good one. By the end of that one, I didn't have, actually I don't think I wore contacts on, I wore glasses. I remember having to take my glasses. They make you take your glasses off because they don't want glasses flying around. So I had to take my glasses off so that I'm blind. And then it's just whirling around, and like I think I was like crunched down in the bottom of the thing. I was like scooted down as far as I could get, and I was just like hyperventilating. And I survived, but boy, that was just like not fun. I would never go on that again. And yeah, so we're all different. We all tolerate different things. Some people just thrive on that, and some people just don't. So we do have to keep that in mind when we're thinking about like looking at our patients' anxiety levels. So you may see somebody in a situation and think, well, why can't they tolerate that? Why are they anxious about that? But maybe because it doesn't make you anxious, but it makes them anxious. So there's really a lot of individuality in anxiety levels. And I suppose none of you have ever experienced any anxiety ever, right? No. It's totally unfamiliar topic, right? So I don't know. If you're like me, when I was in nursing school, that was probably the worst. Well, besides being on Space Mountain, probably being in nursing school was probably like one of the most stressful, anxiety-producing times. I don't remember ever having anxiety like that until I got into nursing school. So I totally relate.
It's so great because I have two bachelors and I don't ever be stressed. As much as I'm stressed in like the nursing, I felt like that was like a walk in the park.
Okay. Well, yeah, I wish we could do something to make it a little bit less stressful. But I try. But anyways, yeah. So stress. we're going to be looking at stress. So you could probably relate to, this example. So little case study. Maggie, a college student, she's having stress in her life. I don't know what to do. I mean, this is supposed to be awesome, exciting time in my life, going to college. I love college. I love being a student, but trying to juggle schoolwork, job responsibilities, single parenting is making me feel pulled in a million directions at once. So some of you might kind of feel like that too with, with other things going on in your life. So we'll kind of get back to her eventually. So theories, again, I'm not going to test you on theories, but it's just that this is where we get information for what we do with patients in the mental health area. So you've probably heard of like the fight or flight response, right? So either you stay and fight or you run. So probably most of us would tend to run, right? I would think, unless you get panic-stricken and you're frozen, but so you kind of prepare for a situation and you perceive that that's a threat to your survival. And men and women actually have different responses to stress also. So just something too to keep in mind when you're working with patients. So Hans Selye, the general adaptation syndrome, alarm or acute stage, resistance, exhaustion stage. Actually, if people do reach the exhaustion stage, and they're under such severe, constant, unrelenting stress, they can actually die. I mean, your body can actually physically give out and die. So, let's see. I think in your book on page, you don't have to bring your book or anything, but I'll just point out, on page 158, there is just a basic little diagram of that general I can't talk today. Adaptation syndrome and the stages and just what it does to your body. So just like short-term effects and long-term effects. So some of the long-term effects are really bad with heart disease, platelet aggregation. So you think you're more at high risk for strokes, high triglycerides, glucose intolerance. So you're going to be developing heart disease, diabetes, digestive problems, chronic anxiety, hyperventilation, kidney disease. There's all kinds of bodily. It really does affect every single system in your body. So there is something called, there's the other theory, part of his theory is that there's actually something called good stress. So that would be eustress. So distress means like bad, negative things happening. Eustress are positive things in your life. So, such as getting married, having a baby, those things, going to school, graduating from school, getting a new job. Those things are all good. They're good stress. But of course, with those things come some changes also. But they're more things that are positive and motivating, okay? Versus distress, which are just negative things that happen to you that aren't good. There's just nothing positive about it. Getting back to Maggie, she's aware she needs help. So on the 3 afternoons a week before she starts class, she has lunch with her 2-year-old daughter. And then she goes to a yoga class, and that provides childcare. And then after yoga, her sister picks up her daughter, and Maggie goes on to class. I'm trying, she says. It's still not easy. I feel a bit overloaded, but this is at least making some difference. It's a start, a step. So doing things that are self-care. It's funny because I had a student we were off yesterday. Wednesday in Lifespan Clinical asked me at the end of our post-conference, because, mental health, wait till you're in clinical. The 3 of you have been in clinical. Sometimes listening to a report is really stressful, right? Some of the patients are very tragic, with their life circumstances, things that are going on in their lives are just, it's so, so tragic sometimes. How do you keep yourself, she asked me, how do I keep myself going? After all these years I've been a mental health nurse, how do I not get swallowed up by all the anxiety and by all the, the stress of the patients? Because, first of all, anxiety is contagious. And I think my students this week absolutely understood that. Anxiety is contagious. So what do you think I mean by that? Some of you are kind of shaking your head. What do I mean by that if I say anxiety is contagious?
Somebody's all worked up and they're talking to you and they're all worked up about it too.
Right. You feel their anxiety, right? We pick up on their anxiety. So it's really important to think about the way we interact with our patients, because if we're anxious, patient's going to pick up on it. Okay? And if the patient's anxious, we pick up on it, and then we become more anxious. And we have to watch that and make sure you notice that in yourself, because that could affect what you're doing as a nurse, and it could maybe even make you rush into something and make a mistake, and then the more you get anxious, then the patient's going to pick up on that and get more anxious, and you're just going to be feeding off of each other. So, we actually had a little bit of that last week too, where a student was looking a little anxious passing meds for the first time, and the patient picked up on it and said, just relax. You know how it is when you're fumbling with those darn pill packages for the first time, and they're not peeling the way they should be, and all that. It can be very anxiety provoking. So actually, the other funny story about anxiety, I'll get back to my original point eventually. The other funny story about anxiety is that I did have a student a long time ago. Apparently she was very nervous going up and talking to her patient for the first time. And apparently that was very evident to the patient. She was really showing her anxiety. So the patient said, look, you're anxious. I can see you're really anxious. You sit down there and I'll just tell you my story. So then she immediately felt better, and her anxiety level just decreased immediately when he said that. And, and then she realized that I guess I didn't have much to be anxious about. But anyways, so that was kind of cute. So patients do pick up on our anxiety. But self-care is my original point, that we do have to take care of ourselves. And when you work in any area that's stressful, and, think about it. Yeah, people are suicidal in mental health, and they have terrible, tragic situations. They're homeless, and you think, how in the world is life ever going to get better for them, and how stressful that is. But, you can work in OB, and you can have, a baby born with birth defects, or you can be working with people with cancer or other deadly diseases that don't have a cure, Huntington's, ALS, right? So there's tragedy really in probably every area of nursing. So the point was that self-care is very, very important to kind of just survive. And so that's what I shared with us, with the students, that, you go home and you have to separate yourself. Be with your friends, your family, do your things, whatever you do that makes you feel good, makes you, decreases your stress. Watch a funny movie, play with your kids, whatever it is, hang out with your friends, do things that are self-care. Personally, I don't like yoga. I tried yoga once. Does anybody do yoga? I wish I did. I wish I liked it. You like it?
I loved it.
Do you? Okay. Yeah. Anybody else?
I tried it. I just wasn't very good at it, so I kind of gave up.
Okay. It's harder than it looks. Yeah. I tried it, yoga on the beach. Actually, I tried it twice. I tried it for 2 summers. They had yoga on the beach. And I felt worse after the class than I did before the class, so I gave up. I like my exercise where I get my heart rate up and all that. I don't know. But for some people, yoga is extremely, people rave about yoga, just extremely relaxing and just a wonderful way to do some self-care. So even in school, I know you think you're busy. Well, you are busy. You don't think you're busy. You are busy, but sometimes you do have to take some time for some self-care, right? Okay, so again, good stress versus bad stress. We kind of talked about that already. That's just some examples. So, alrighty. So we do have some issues with neurotransmitters, of course, when we're thinking about stress. So serotonin synthesis. So some stress might impair the serotonin receptor sites. So then, therefore, we're going to become more anxious. And also, serotonin works with depression. So again, that comorbidity of anxiety and depression, the 2 of those go absolutely hand in hand. And immune system stress response. So do you notice when you're more stressed that you get sick? More, right? I can notice that sometimes by the end of the semester, everybody is getting sick just because of all the stress. You're staying up late, you're not getting much sleep, you're going to clinical, you're getting up early, you have so much to do, and we end up, it does affect our immune system, and we do become physically sick at times when we're under a lot of stress. So mediators of the stress response certainly would be things that we have to think about as far as our perception. So what is the meaning of the stressful event to you? Maybe somebody is very happy to move across the country away from their friends and family, and for somebody else it's devastating. Okay, so the perception of the event to that person and that individual temperament thing. We're all born with our own different temperaments. So anybody in here have any kids? And of your kids, did you notice like a particular temperament like when they were a baby?
Well,
I'll pick on Katie for a minute.
They can't even diagnose her with what she has. At first, they thought she was autistic.
Oh,
So then right now
okay.
they're not to the point where they can actually identify, but she has temper tantrums all the time.
Oh,
It's like every time I walk
okay.
into Walmart, the second we walk in through the doors, then it's like something
shoot.
triggers. Yeah.
Probably that overstimulation. How old is the baby?
She's 6.
Oh, 6 years old or 6 years old? Oh, okay, all right. So, but that temperament was there at birth. She was kind of like that as a baby also.
Mm-hmm.
Is what
I
I'm
would say,
thinking?
like, I started noticing about 18 months, and that's when I started getting like therapy for her.
Ah, okay, all right. So sometimes what you see at birth, that type of temperament kind of persists through adulthood. Do you have an example, Sandy?
I don't know, my daughter's just hyper.
Okay. Was she like that always?
Yeah, like
Okay.
she started walking at like 10 months. She
Okay.
was very active from the point.
Okay. And how old is she now?
She's about to be 2.5.
2.5. Okay. All right. So what you saw as an infant, you're still seeing as a 2.5-year-old. And it'll be interesting to see as she grows that same temperament kind of persisting. Yeah. Yeah.
Kids, but my younger sister is like that. Her temperament, like when she was a baby, she's always super happy.
Yep.
As, unless she was in pain or tired,
Sure.
and she's still like that. Like she's just always happy.
Yes. Exactly. You
I
gotta-
had colic as a baby, and it was only from like 5 at night till like I went to bed, and my mom's still convinced that I'm cranky. Like
Even
she'll
though
tell
you're
people
not.
like, "Watch out, it's 5 o'clock."
Oh, really? Oh, that must have put quite a memory into her that she's
Yeah, I
still
guess I
thinking
just
about that.
screamed from like 5 o'clock one thing, and I would just scream until I went to bed. But I slept through the night.
All right, that's good. So yeah, my boys, I noticed that too. My older son was a preemie, and he kind of was colicky too. So he would start. I wasn't necessarily at 5 o'clock sharp or anything, but he would start screaming too, and just be highly reactive, and just always kind of, that type of person. And he still is, and he's 26 years old, so he's still that. And my younger son's always just been more laid back, fine, everything's good. So I remember when he was little, and we would be driving back to Rochester, New York to see my family, and he'd be in the back seat in his car seat, and it's a 700-mile trip, it's like 12-hour car ride. And we didn't realize that he was like a car sick kind of kid. I remember the first time, all of a sudden we were like looking back and thinking, okay, you guys okay back there? Yep. Matt, everything good? I'm good. 2 minutes later, stop the car, clean him up. And then we'd be driving along again and be like, Matt, you okay back there? Yup. It's like, okay. And he's still like that. He is still like that, 24 years old. So, yeah, your temperament kind of is something that stays with you. And that doesn't mean that you can't ever work on it. Like if you're that like highly reactive, emotional, like fly off the handle kind of person, it doesn't mean that you're going to be a difficult person the rest of your life. Some people just have, no, it doesn't. Because you can work on things. Like my older son would be, he gets frustrated easily and stuff, but there's, he's, over the years, I can tell that he's kind of been working on it, been trying to help him with that too, and he's better at this point. But it was bad when he was a teenager and he was working at McDonald's, and then there were certain customers that would just drive him nuts, and so I'd always have to give him a pep talk, and there was one person that probably had OCD. Mom, she won't let me touch her cup, and she was always asking for this, and she wears the same thing every day. Nick, I'd be kind of. Okay, but you got to be patient, so it's not that you can't ever change or learn to grow. It's just that that's your inborn, so you have to learn to work with it. So anyways, I just think that's kind of a fascinating part of, social support. So if you have a support system, you are less likely to have adverse effects of stress because you have people around you. You have either a support group, perhaps, if you're going through something and you join a support group with people going through the same thing you are. That's super. But your support system can just be your friends and your family and just people that are there for you and they're not critical of you. Your culture, so that can actually either help or hinder the way that you respond to stress. And your spirituality and religious beliefs also. I've seen some patients that have had some spiritual and religious beliefs that are just kind of contradictory to mental health. Like their church would tell them, don't take medications, they're bad for you, and they really feel like their sinfulness is the cause of their symptoms and all that. So sometimes spirituality and religious beliefs actually can be more detrimental than helpful. But some religious and spiritual beliefs, of course, can be very helpful. So, all right. There is, on page, 163, in the Varkarolus, there's this life change questionnaire. And I actually did this on myself when I moved because I had an 8-month-old and a 2.5-year-old. And I was leaving my job behind in New York that I loved. I loved my job, absolutely loved it. And I was so sad to leave that behind. And all my friends and family, I grew up there, so... and we were building a house. We were moving into a little apartment, had to put half our stuff in storage. So I went through and I kind of went and, added this all up on myself. And I was 400, 500, something like that. And that's, I think if you get over, it's over 300, let's see, a 6 months score of 300 or more, or a year score of 500 or more indicates high stress. And that just means that you probably are likely to have some physical consequences of stress. So if anybody ever wants to do that on yourself, it's just kind of interesting to look at, your stress level. And I think for me, it manifested itself in that, I've had migraine headaches since I was 19. I kind of came down with them, but I remember always having headaches my whole life, even as a kid in grammar school. And I got more migraines. I took that little quiz and, I was getting 2 migraines a week, which was very unusual for me to get that many. So I think that's how that stress level kind of translated for me. So it is useful just to see to kind of predict if people are going to become physically sick or not. Or it could be, you could develop mental illnesses too from high amount of stress. So, all right. Anybody have any questions? I thought I saw a hand go up. Okay. All right. So we have to assess coping styles, think about health-sustaining habits, life satisfaction, social supports, effective and healthy responses to stress. So just thinking about how people, if they do things that are health-sustaining versus, detrimental to their health. So what are some health-sustaining habits that you can think of? Mm-hmm. Definitely. Eating healthy. Getting enough sleep. Absolutely. Anything else? You got most of them there. Let's see. Well, okay, actually, there's on page 162, there's a little box called Effective Stress Busters. So sleep is on there. Aerobic exercise. Let's see, what else do they have here? It doesn't say anything about eating healthy, but it does say reducing or cessation of caffeine intake. As I sit here with my cup of coffee. So, they're saying no more than 4 cups of coffee are recommended for anyone. No more than 4 cups a day. Does anybody think they go over that? Yeah?
Well, when I was pregnant.
Yeah, when I was pregnant, I remember I didn't have a taste for coffee. It just didn't appeal to me at all. So I didn't drink it at all. But normally I would drink probably a pot a day. I don't drink that much anymore. It's 1 or 2. 2 is my limit. But what's interesting about the whole caffeine thing is that when I take you on a tour of the unit, do you guys remember how much caffeine, the 3 of you in the back, how much caffeine can the patients order per day on their menus? Do you remember? 9. It's 9. They can order 3 caffeinated beverages per meal. So they can order 9 caffeinated beverages per day. think about it, and then think about how much Ativan we're giving out. Although I think they're getting better. The unit is getting better with trying to have people use non-pharmacological resources first, which is really good because we just don't want a bunch of people addicted to Xanax and Ativan, those types of things. So, yeah. Yeah, non-caffeinated beverages. Matter of fact, I overheard a patient on the phone even telling a family member that they couldn't believe how much caffeine they were able to order. Seriously, I was like, oh man, the patients are thinking this is like outrageous. It really is. So anyways, music. So that music that I gave you. Pets, except if you're allergic, right? Or if you hate anybody, a dog or cat hater. Like you just hate her. Yeah? Are you, Cindy?
No. I don't like cats.
What causes you stress? Your dog? Oh no. Oh, puppies are,
They're like toddlers.
yeah, something like that. But for some people, like if you're a dog lover, you probably think everybody loves dogs. But there are some people that just don't like dogs, or they're afraid of them. What?
We don't talk to them.
Oh, and then there are people that like love cats, and then there's people that hate cats.
I don't hate them.
So
Stay away from them. Yeah, exactly.
So pets, could be they could be bringing joy and reducing stress if you like them.
It's funny you say that because after my grandpa's incident with the shooting and stuff, like my brother we ended up getting a dog and then helped with that.
Oh, wow, okay, great.
Like I don't know, it's just like a barrier in between that just like
Uh-huh.
stops them from just thinking about stuff that he's not thinking about.
Yeah.
It's like he just like fills a void in her like vice versa.
Absolutely. Pets are powerful. Sometimes pets are actually, we're not talking about suicide yet, that's Learning Plan 3, but honestly, pets sometimes can be a protective factor to keep people from committing suicide because they just love their pet so much and they know that they need to take care of that pet. So if somebody gives away a pet, that would be, like for no other apparent reason, that could be a sign that they may be thinking about suicide or planning to commit suicide because pets are so important to people. So, anybody else have anything to say?
Oh, it doesn't have anything to do with the mental health, but
Okay.
I work on the cardiac for one of our patients this week, or yesterday when I worked, or Wednesday when I worked. She had a dog that helped her detect when the insulin was low, and I had to go in there a few times, but you could just tell, like, having the dog, like, sitting on the bed next to her just calmed her.
Yeah.
And you could kind of see that because she wasn't, like, in the hospital and being freaked out, so you could
Oh my
tell that kind of
gosh.
helped her to
Oh, that's very
calm
cool.
down.
Yeah. Huh. Very cool.
It was still puppy and training too. It was the worst thing ever because you couldn't pet it. It would like come up and smell.
Oh, and you wanted to, but you can't, right? Yeah. Oh.
Every time you went in there, like, I had to get a blood sugar a few times, and it would like, are you watching me?
Oh my gosh.
Can you come and pet me? And then
Huh.
the owner would be like, no, stay there.
Yeah. Oh, that's neat. Yeah, therapy dogs are so helpful for people, or different types of therapy animals too can be real helpful for people. Huh. Alrighty. And if we just have like built up a repertoire of healthy responses to stress. So if you just kind of build up your way of your coping mechanisms to deal with stress. And again, they're going to be different for everybody because somebody might love, it seems like a lot of people love those adult coloring sheets on 1K, but some people might not like that. That just might not be their thing. So it's really individual, and you have to help people to find things that are going to help them healthily respond to stress. It could be writing poetry, could be playing an instrument. There's so many different things we can do for relaxation. Okay, so we're thinking about Maggie again. So she's trying to manage ways to deal with stress in her life, and she's working on those. And the yoga class, Lunch with Her Daughter, has been very effective for her. And for social support, she's relying on not just on her sister, but on a group of single parent students that she finds on campus who meet and share things that work for them. So that is just a really helpful thing. So sometimes when you're under stress, you're just not thinking maybe of all the options that are out there, and it might be helpful for you to share what you do because that might be enlightening for somebody else, or somebody else might have an idea that could be very helpful for you. So all these different types of things are very helpful for relaxation techniques. Journaling, though, I'm just going to kind of mention that for a minute. Journaling can be helpful for some people, but actually not helpful for others. There was one patient who did not like journaling because she felt it just made her more angry. Like she'd write down things that bothered her and then she'd ruminate about them and just keep reading it and get more and more angry. So for that type of person, journaling is not good. But for some people, they write it down, they close their journal, they put it away, and they've just gotten rid of all those feelings. But if you're ruminating about it and all that, it's probably not very helpful. So, all right. Anxiety and obsessive compulsive disorder. So I will have a little OCD video to show you in a little bit. So basically, anxiety, we all kind of know what that is. I don't think anybody that is alive can say that they have never experienced any anxiety because it's just such a universal thing. So apprehension, uneasiness, uncertainty, or dread from a real or a perceived threat. Fear is a reaction to a specific danger. And normal anxiety is necessary for survival. So when's the last time that you have had any fear, like reaction to a specific danger? Can you think of any examples of that? Yeah. So driving to clinical when the weather is horrible and roads are slippery? Sure. Absolutely. Seems like I had an example. I can't think of what it is right now. Well, was anybody on campus when they called that lockdown? You were trying to get in? Oh, okay. So did anybody have any kind of, you weren't in the building though at the time?
No, we're trying to get in
We were opening the door and alternate lock.
Oh, okay. All right. So I was in this room actually because I got here super early that day and like 3 students were here too. They just for some reason got here at like 7:10 or something like that. And then when we heard that we got stuck here. And then the fear was like, look where we are. We're right here. Look at the big window. There's a door right there, an entrance door. And you just felt like we were targets and then we weren't really told what to do. So there definitely was fear there and we weren't sure what was going on. And if the threat was, realistic or not, what should we do? Should we go hide in those closets over there? Should we barricade the door? It was just a lot of confusion and some fear. So that was a very specific danger. If there's a shooter, that would be a pretty terrifying situation. So normal anxiety is necessary for survival because if we didn't have anxiety, we would just walk across the street perhaps and not even look both ways, right? And then a car would hit us, right? We need some anxiety in order to survive. So the levels of anxiety. So there definitely will be some test questions on the levels, differentiating the levels of anxiety. And it can be a little bit tough because I think mild and moderate are pretty easy to differentiate, but when we get into severe and panic level, a little harder to differentiate. So mild anxiety is just what is good for us to have. So that helps us with problem solving, that we can grasp information more effectively. So in other words, when we have mild anxiety, we're paying attention. Okay, so like if I say, oh, this is going to be on the test, right away your anxiety just maybe goes up just a little bit, but still in that mild level. And you're like, oh, I need to pay attention to this. I need to write this down. I need to really listen or whatever. So mild anxiety is very, very helpful. Moderate, though, if you get to a moderate anxiety level, you start to not pay attention to certain things. So selective inattention. So you miss certain things. You might miss some very important details. Okay? It's going right over your head. You didn't even hear it. Do you ever have that happen where you just miss something and somebody else tells you something and you're like, oh, I didn't hear that. What? What are we supposed to be doing? I've definitely done that. I missed a whole assignment in nursing school once. Literally, we were supposed to be tracking our own I&O. I still remember that 38 years later. We were supposed to be tracking our own I&O and then doing something with it. And I didn't do it because I just didn't hear it. I didn't know we were supposed to be doing it. So, yeah, that's what moderate anxiety can do to us. So our clear thinking is hampered. We're not optimally solving problems, maybe a little bit, but not at optimal level. And then we're starting to get some sympathetic nervous system. So we might feel a little bit jittery. We might have a little bit of stomach upset and just kind of a little hyperventilating. But Not enough to severely like impair us, but enough so that we feel uncomfortable. Severe, this is where your perceptual field is greatly reduced. So in other words, you're not paying attention to most of what's going on around you, but you are able to pay attention to some things going on around you, okay? So think about the person who needs step-by-step directions to accomplish something. So they're so anxious they can't really think through something themselves. So you maybe helping somebody write out a check. So you say, okay, take the check out of the, out of your checkbook. Get out a pen. Put the date down. You know what I mean? You're telling them step by step what to do because they're not really able to problem solve and think through things. So they have difficulty concentrating. And the somatic symptoms are increased. So they might have definitely some shortness of breath. They might have palpitations. They're feeling dizzy, nauseous, chest tightening, the whole thing. They may feel like kind of like an impending doom, like something bad's going to happen. But they are able to pay attention to you and talk to you, but just kind of in a limited way. Then in panic, so the big difference between severe and panic, because some of those somatic symptoms are kind of the same in a panic disorder and severe anxiety, because they also are going to feel like impending doom, like something terrible is about to happen. Heart palpitations, shortness of breath, nausea, throat tightening, chest tightening, all those terrible things, real uncomfortable somatic bodily symptoms. But they are not able to focus on anything around them. When you're in a true panic state, you are completely absorbed in yourself and how you feel. You are not perceiving what's going on around you. So you're not able to talk to somebody, answer questions. Like if you're sitting there being interviewed in the emergency room, you're in a panic state. You're not sitting there talking, answering questions and listening to what the nurse is telling you. You're not perceiving anything that's going around external to you. So they might have markedly disturbed behavior, running, shouting, screaming, pacing. They can't process anything, and they're very impulsive. So you really have to watch people carefully and not leave them alone if they're having a true panic attack. So really the difference between those two, the biggest thing to probably remember, so you'll answer your test questions right, would be that it's that ability to, when you're in severe, you are able to connect with something around you. Okay? You can talk to somebody. You can carry on a conversation, even though you might need step-by-step directions to do something. But in a panic, you're not. Okay? You're really totally into yourself, and you're not perceiving anything around you. Okay, a little bit of an audience response question. Anita, 34, is shopping with her 5-year-old daughter at a large, busy urban mall. When she suddenly realizes the child is missing, which level of anxiety would likely result, do you think? Well, mild or moderate? Panic. Yeah, I would say, yeah. Mm-hmm. Yeah, if all of a sudden you've got your 5-year-old and you're in a busy mall, tons of people around, and you look around and you realize they're not there, you're going to panic. Okay, your child is missing. You don't know where they are. This is a huge place. What if somebody stole your child? Right? You start thinking the worst. So that would be according to the book, anyways, that would be a panic. Okay, so what behavior might she be exhibiting that would indicate panic level? So seeing and grasping information efficiently, able to quickly make problem solving more effective. Voice tremors, perspiration, headache, dazed, confused, automatic behaviors, aimed at reducing anxiety, running, shouting, screaming. Yes, D. That would be the one that would indicate a panic level. All right, so we do have defenses against anxiety, things that kind of protect us. And I actually have another whole little separate PowerPoint that I think I'll show it to you after the break, because if I do it now, it'll mess up my recording, and this is just really fussy software to use for the recording. So I think I'll show you that afterwards. I have these little cartoons that kind of go through some of the defense mechanisms so that you'll understand those. So those are just automatic coping styles that we use, and things that are unconscious. We don't usually think that we're we're not aware always that we're using defense mechanisms. They just kind of happen suddenly. So they protect us. They could be healthy or unhealthy. So we'll kind of talk about that when I go through the other little PowerPoint. I'll do that after the break. So, actually, does anybody know what probably one of the most common defense mechanisms? Do you know what those are? How about denial? Right? If you've heard of denial, that's probably one of the most common defense mechanisms, and we all use denial. So we just can't use it too long, otherwise it gets to the point of being unhealthy. So we'll visit that in a little bit. So, all right, so Anita now finds her little girl, Hillary, close by looking at kittens in a pet supply store window, and is obviously relieved. I feel sick to my core, she says. I thought for sure my panic attacks were coming back for good. So she has a history of panic attacks. She has in the past frequently experienced sudden feelings of impending doom in which I feel like I'm losing my mind or having a heart attack. They started when I was a teenager. So the thing to get out of this is that sometimes a situation can cause us to panic. Like all of a sudden your child is missing, or you get really bad news, or something bad happens and you panic. But panic attacks, people that have true panic disorder, the panic attack just comes out of the blue. And they could be asleep and wake up and have a panic attack. Or they could just be doing anything normal, just cooking dinner, doing the dishes, and all of a sudden they have a panic attack. So again, our nervous systems are all different. So some people just have that genetic predisposition or that dysregulation of their neurotransmitters, and they can be prone to having a panic attack, not related to any particular experience. So some other clinical pictures, some other kinds of disorders, separation anxiety. So this is something that is developmentally appropriate for young children, right, to have some separation anxiety. Do you know about what age it is that a child actually realizes like that their parents are leaving and they start getting stranger anxiety? Do you know about what age that is? Anybody? Do you notice that in your daughter that's 2.5? When she started first like being worried, like if you were leaving her with somebody else, that she'd be upset.
She just started being aware of it.
Mm-hmm.
For her parents.
Yeah.
She's with my mom Monday through Friday.
Okay.
So like she knows the difference between like those are her grandparents versus her parents.
Okay.
But now she's starting to like, if she doesn't see us, like, or she doesn't FaceTime us, she tends to get a little.
Okay. Yeah, exactly. Yes, exactly. So it's kind of like, that it creates like a little bit of an unsettled feeling because they're just kind of wondering. Have you ever tried to have her be babysat by a stranger, somebody else who's just a babysitter? Okay. If you do, I would imagine that would even provoke a stronger type of response, right? And I think sometimes around. Oh, go ahead.
I babysat this little boy for the first time. He was just under 1, and he cried the whole time his parents were gone. Like it was like 3 hours. He cried the whole time.
Oh,
it was
terrible.
But
Yeah.
I couldn't do anything. Like I tried like rocking him, bouncing, walking with him. I set him down and just kind of like where I could see him, but he couldn't see me.
Yep.
So
Yep.
maybe, but nothing.
Yeah.
My cousin started picking up at 6
hard.
months.
I'm say what?
My cousin, like the oldest one at 6 months, but now none of them have a problem. The youngest one is 2, and he doesn't care. If his mom leaves when his brother's in, he's like whatever. But
Oh.
if they're not there, then he still cries.
Oh.
But it's kind
Okay.
of like a very pathetic, like, I know you, but I want my mom.
Gotcha. Yeah, it's hard when they cry and cry and cry because you're not the mom and they don't know you and you're like, you can't do anything. So usually around I think it's around 6 to 9 months that it can start, especially if you do leave somebody with somebody that they don't know. They do recognize that they're, that's not mom, and they can really get very, very upset about that. So does anybody know any older children that still have separation anxiety?
My cousins all do.
Really?
He
Oh.
won't cry, but he's
Okay.
like, why do you have to go? Where are you going? What time? Because he can tell time. And I was like, what time do you get back?
Okay.
So I was like, whatever. Goodbye.
Okay, so he might have a little anxiety then, for sure, a little separation anxiety. So it'll be interesting to see as he gets older if that kind of persists, that anxiety persists. Yeah.
I did when I was a kid. Like, I would have babysitters that I knew would be my cousins or whoever.
Okay.
And then when I'd have to go to bed, I would get up like 5 times and be like, are my parents home? Or are they coming home? And I would lay in bed awake thinking about what if they got in a car accident? What if they're never coming back? I
Yeah.
was super anxious.
Yeah. Yep.
It went away. Like,
Yep.
I can be away from this.
Sure. Yeah, and some kids do kind of grow up out of that, but some people it might be a trait, kind of a personality trait that kind of can persist, that little bit of extra anxiety. So anybody to the point of anybody to the point where they can't, you said all your cousins are, but can they go to school? I mean, are they able to go to school? Do they go on sleepovers at friends?
No, they only will sleep at my aunt's house, which is their grandma. And that's,
Okay.
they can like see their house from their house.
Ah, okay. Okay, yeah, because some kids as they get older, even like 10-year-olds, 11, 12, still can't go on sleepovers because they get homesick. They get that separation anxiety and they can't be away from their parents. But some kids, it's to the point where they can't go to school, and that would be really difficult to, to work with. They really need some professional help if they're at that point where they actually can't go to school because they have that separation anxiety. Adults can actually have a little bit of separation anxiety too, but usually we kind of think about that as children. So again, we have that thing called, there is a panic disorder separate from just having like a situation, and people experience panic attacks. And again, they can come out of the blue and kind of surprise you. So agoraphobia. So we have a couple of different types of phobias that we can think about too as part of anxiety. So agoraphobia is, have you heard of that before? Anybody hear of agoraphobia? So I think the translation is, it's a Greek word that kind of translates into fear of the marketplace. So fear of being like outside in an uncontrolled environment, outside of your own home. Some people can't even leave their house to the point where they have to get therapy in their own home. Like the therapist has to come to their house and help them to deal with and to get over their agoraphobia so that they can finally leave their home. So they feel like trapped and like escape might be difficult or embarrassing. So they really do have a hard time with being anywhere. All right, let's see. So specific phobias. I was just trying to look in my book to see where the list of phobias.
There's a show where someone's like that.
Oh, with agoraphobia? Yeah. Oh, okay. I don't watch enough television or movies. I really should watch more. But anyways, yeah, I bet there are. It's interesting. Can you imagine just being trapped in your home and just you can't drive anywhere, you can't go anywhere, can't go out to eat? So specific phobias. Can you think of any other things that people are have as far as specific phobias? Germ phobias.
Like animal-like spider phobias.
Spiders. Snakes. Claustrophobia. Did you say, you said something too, Katie, didn't you?
That's a germ.
Germs, okay. Heights. Uh-huh, yep. Yep, so maybe the skydiving, the people who are hesitant to skydive, maybe part of that is like a little fear of heights. Perhaps? I don't know. Clowns. How about clowns?
Those mascots with the heads.
Yes.
I hate those things.
Yes.
Disney World was torture. I
Yes.
hate those things.
Yes.
So creepy.
That's actually, I can't find the list right now, but anyways, yes, that is very, very common. Very common.
See, my mom was mad because I only took a picture with Pocahontas because she was just dressed up.
Oh.
Not like
Yeah,
a
gotcha.
mascot.
Gotcha. Yep.
Yeah.
Yep. Yeah, clowns too. I mean, there are some people that have clown phobias. I had a student once that had told me she had a feather phobia. I was like, feather? It was interesting then because one day on clinical we walked into the unit and you know how in the winter sometimes people have coats that like have that down and like feathers just kind of. So all of a sudden I looked down on the floor. There's feathers on the floor. It's like quick got him before she saw it. So I thought I didn't want to get her into a anxiety attack here. But anyways, feathers, cotton balls.
Yeah, my cousin won't do it.
Yeah.
They wrap his presents in it. Like the first present in the bottom, the cotton balls on the top.
Really? Oh, that's mean. Oh, interesting. Huh. There are so many different things that we can be phobic about. It is really kind of interesting. Okay. There's something called social anxiety disorder. You've probably heard of that. It seems like that's gotten a lot of, movies and different things, portray people with social anxiety disorder. I think it's kind of out there a little bit. Common person seems to know a little bit about it. So that would be that person that has anxiety or fear provoked by exposure to a social or a performance situation. And they fear that they're going to be evaluated negatively by others. So it's not that they are negatively evaluated, but that's their fear. So people that have trouble talking in front of others, or even just going to the bank and signing their name, eating at a restaurant in front of other people. There's a lot of patients on 1K that do not want to go to group because they have social anxiety and they don't want to sit there in that group situation. It's just really stressful for them. So, they try to get people to go anyways, but they really have a hard time if they truly have a social anxiety disorder. So they really tend to limit their social interactions with people and things like that. Generalized anxiety disorder is just excessive worry that lasts for at least 6 months usually. And it's like you get up in the morning and you're worried and you're anxious, and it kind of persists all day long, like until you go to bed at night. So it really can make people feel very uncomfortable, very difficult way to kind of live your life. But usually, again, it has to be for a certain time frame because everybody can experience, again, on that continuum, we can all experience anxiety with different things going on. And you definitely, in nursing school, it's definitely a stress. I just definitely remember having anxiety in nursing school. So I totally relate to that. So other anxiety disorders, you can have anxiety from substances. And we did see a guy this past fall, who had anxiety from excessive use of marijuana. So he was smoking marijuana excessively, and he was developing an anxiety disorder because of it. Well, just think about usually any substance, drug, alcohol, is going to be messing up your neurotransmitters. There was a patient long time ago who was huffing paint, okay, and he developed brain damage from that. And the brain damage for him was that he had chronic, unrelenting anxiety that wasn't going to go away. And they tried giving him benzodiazepines. Medication wasn't working for him, but just because of the effect of the huffing, that he ended up having terrible levels of anxiety. So it can be from a substance.
I remember a while ago, those caffeine pills you can take to stay awake.
Yes.
Oh, I was like, well, I'll take these instead of drinking coffee. Oh my God, I was so anxious I couldn't focus on anything at all. I just felt like I was on edge at all times.
Yep.
And they're over the counter. It's just not it's not like
I know.
all that's prescribed for you.
I know.
But I was like, okay, I'd rather drink coffee because I felt like I was jittery, and I actually went opposite. I couldn't focus whatsoever.
Mm-hmm. Right.
Because anxious about everything.
Right, because you think, give me a little caffeine and I'll be focus, right?
Yeah.
No, it does the exact.
I just overdid the caffeine.
I did that too once when I was in college. I took some of those over the counter caffeine pills, and I remember because I was trying to stay up and study for exams and whatever, and at the end of it, I got really, I was taking for I don't know how many days in a row, and at the end of that time period, I remember being at work. I was a CNA in a nursing home. And I remember just feeling really weird all of a sudden, and they took my blood pressure, and it was 60/40. It was my blood pressure had tanked because of, I think, the fall-off effect of all that caffeine. So I never, ever, touched those again. Yeah. I got really mad because my sons both have a little bottle of those, and don't take that stuff, you guys, but anyways. So, yeah, that's a really good point to bring up, because we do have to do some teaching about the effect of caffeine on anxiety. Because if you have anxiety to begin with and then you pump yourself full of caffeine, it's just not helpful at all. So we can also have anxiety due to a medical condition. So can you think of any medical conditions that have a symptom of anxiety, or even some medications that we take that might cause anxiety, like typical, think cardiac, respiratory, thyroid, those types of conditions and or medications. So can you think of any examples that you've seen or heard about?
I had a patient, she was in with pneumonia, and every time she got up to the bathroom, she got super short of breath. And then one time they got her back into bed and she was having a panic attack.
Yes, definitely. That's a really, really good example. Yep, absolutely. So when you can't breathe, you have something impairing your breathing, absolutely anxiety follows that. Yep, that is a side effect. Yep. Anything else? Yes. Yes. Usually if you're hypothyroid, you're going to be more depressed. And if you have hyperthyroid, absolutely, you're going to have some anxiety. Yes, definitely. Anything else that you can think of?
I know people that have taken like Adderall and they're not prescribing them, like they don't actually need it, they're like on edge and
Yes. Yes.
crazy.
Yes, definitely. Yeah, it seems like it's become, I've read some articles that talk about Adderall's become kind of a popular college drug to use, to get either to buy from your friends or to get a prescription, and the doctors shouldn't just be prescribing it because the student says they can't concentrate. You know what I'm saying? You really should have a thorough workup to really get a diagnosis, because you're right, if you take the pill and you don't have the actual diagnosis, it's a stimulant. But if you have ADHD, it actually works to kind of calm you down. It has the opposite of like effect in your brain. So, yeah. So people that are using it to get better grades, not a good thing.
Well, my brother ended up being diagnosed with, but he said it took months and months for them to he was like, I had to go through so many therapies and trials
Yes.
to actually diagnose me and to get it right. So I don't know how those physicians would just be like, okay, here you go.
I know, but
he's like, it was very expensive.
Exactly.
Like, actually need it.
Right.
Dreadfully long.
Yes, I totally am with you 100%. But yeah, physicians shouldn't be just prescribing it, but some do. So, all right. And some of our inhalers, think about anxiety from inhalers. Usually that's right. And what did you just say? Albuterol, yes, absolutely. So that type of inhaler is definitely going to cause some anxiety. There's lots of meds, actually. I mean, when you're doing your, looking up meds for clinical, anxiety is a side effect of a lot of different types of medications. So we just kind of have to be aware of that. Okay, I'm just going to go through this. I will give you a break. So Anita recalls the height of her struggles with panic. My attacks would come out of the blue, usually when I had already been super depressed for a while. They were so bad I started being more afraid of the panic attack itself, and sometimes I'd just stay home from stuff I usually liked, like the high school football games and even slumber or birthday parties, because I was afraid of having an attack in front of everybody. So that is a very important aspect too, because sometimes the panic is it can actually just be exacerbated by a fear of having a panic attack, and people do end up curtailing their activities, and it really does have a significant impact on their life, their social life, and school, and everything else. Okay, why don't you guys take a 10-minute break? All right, we should probably get started again. I'm just listening to you guys talking about animals, and I have a funny story of a friend that has, they had 4 daughters, and their daughters really wanted a cat, but apparently the dad was allergic to cats. So the kids, when they were little, they would beg the mom and say, well, when Dad dies, can we get a cat? Isn't that funny? It's like, oh my God. Anyways, the dad is still alive, and the girls are all in their 20s now, so I think they've gotten past that, but I just thought that was hilarious. When Dad dies, can we get one? Anyways, so animals are wonderful things. Okay, so I am going to go through this defense mechanism PowerPoint really quick. Okay, my stuff. So remind you of micro. How does it remind you of micro?
When I think Deborah was her name. She used to lecture about going to restaurants and how there's germs in the cup or whatever from the lemon.
Oh,
Yeah, and how the cutting board. to think about like all the germs that are in there. Like when you wash it, do you really scrub it, and how do you wash it? Yeah.
Okay. I also heard students talk about like not ever wanting to buy meat from a deli again because of the slicer. Okay. You don't hear.
But I mean, if you start thinking about it, you like can't function at all. If you think about germs, they're literally.
Right. That's kind of what she was saying.
You know, like for her, like that's a real thing. Before we can ignore it, but for someone that actually has a
right,
OCD about it, they can't just ignore it.
Exactly. What were you? You were gonna say something?
Well, I was just saying some restaurants like they usually ask me for lemon, but not like, and now I don't take it. But some of them don't, and then it's sitting there, and it's like.
So what is there about the lemon?
It's like fecal matter.
What?
Yeah.
Fecal matter?
Yeah. There was like a study
For people not washing their hands and then putting the lemon or something.
Really?
Yeah, I don't like lemon.
And they like looked at like
Ooh.
the high value restaurants and like lower restaurants.
Uh-huh.
So now I just know that.
Really?
And it was like in there just floating.
And plus, it's still sitting there too.
More places have more people.
More places have if fecal matter and then they don't.
Really?
Yeah.
Wow. Oh, that's interesting.
You get anything with those, if you're getting a martini with olives, stick with the olives. If you're getting a Bloody Mary.
Well, I always worry too about when you go into restaurants and you see condiments.
Well,
that
that's on top.
are, wait. What?
Just an alcohol
The alcohol's killing the germs. Yeah. Actually, lemons can actually kill some germs too. That's why they, sometimes lemon juice, like squirted on, like raw seafood, can actually kill some of the bacteria.
Well, that's why they'll do it on like cold oysters. And
Yes,
stuff, right?
exactly.
They'll actually get rid of it.
Yep.
I know some CNAs that like never wear gloves, like ever.
Oh.
And I will not even like change a person's clothes without gloves. I don't even touch
Oh,
them.
wow.
Or there's nurses that will do like eye drops and nose and even like blood sugars without gloves. And all
Without
that, but
You know what? When I was I wasn't really a CNA because we didn't have CNAs at that point in time, but a nursing assistant, we didn't even wear gloves for anything. We didn't have them available. We didn't wear them. We would be cleaning up people's BMs and everything, and then just obviously washing our hands really good, but obviously with a washcloth, but we didn't have gloves on.
But I feel like then,
Isn't that weird? But we-
But you didn't have it available versus having the availability there.
Right. It wasn't a thing that nobody wore gloves like for anything that I know of. Probably in surgery they did, of course, but otherwise we didn't wear gloves either. But
You go to different countries,
Yeah.
they always say like don't eat vendor food, like street vendors.
Oh.
I always do. I always
Okay.
do with my husband. I was like, I think that dirty hand just makes it taste better.
oh.
For some reason. I'm like, because I could never get it to make like that at home.
Mm-hmm.
So I always joke, but like they always say, I mean, if you have OCD, I feel like if you would see that, like, and if you lived around like a little village and you had that, like,
Yeah.
how would you even survive?
Yes, exactly. Right. You probably wouldn't be able to. Sure. Yeah. Good points. Oh, I'm gonna remember that about the lemons though. Ooh. Okay. Anyways, yeah. So. Okay, so obsessions are the thoughts or the impulses that kind of, or images that come into your mind that persist and recur so that you can't dismiss them from your mind. They're there. Like Natalie constantly is thinking about germs, in the video. And then the compulsion is the behavior that follows. So that it's ritualistic and the person feels driven to perform in an attempt to reduce anxiety. So the part about reducing anxiety is extremely important to understand why people persist in those behaviors. They get the thought coming into their mind. They can't dismiss it. Maybe we can. Maybe we can stop thinking about the germs, like you said, because otherwise, like, what would we eat, maybe? Except maybe packaged foods. But even then, you never know. But they can't dismiss it, and the behavior, the compulsive behavior, makes them feel better. But they don't enjoy doing it. Okay? They really don't. So if you don't understand that, you might not answer test questions right. Not that it's all about that, but you know what I'm saying. You really have to understand that it reduces their anxiety, but they really don't enjoy it. It's not like it's fun for them to shower constantly or to wash their hands continuously.
Does OCD OCD like come and go? Because we have a resident like sometimes he can't touch anything, he can't do anything, but then sometimes he just can do everything for himself. Like,
Okay.
so is that normal that it like?
He might have some better, yes. I mean, some fluctuation is normal in terms of having better good days and bad days. Yeah, like with any illness, you can have a better day and a worse day. Something but it's never going to probably go away. It can be managed, usually with medication and therapy, but if he's an older person, he's probably not getting anything for it, or...
He's not that old, but he's on a
Okay.
behavioral health or mental health board before, because sometimes he can't even change himself or go to the bathroom because he'll just hold it all day long.
Oh, really?
So we have to,
Wow.
like, make him go to the
Oh
bathroom.
my gosh. Is it related to OCD?
I think he has OCD, but I think he's got other stuff as well.
Oh, okay.
What it all
Okay.
is, but-
Okay. And you can have kind of OCD type of behaviors with other types of illnesses too, like other organic illnesses or other brain diseases. There's a patient that had Tourette's disorder that I remember, and he was in his 20s, and he pulled out all of his teeth with pliers. Okay, he had pulled out all of his teeth with the pliers as part of the like OCD part of his Tourette's syndrome. And he said that the compulsion or the obsession about needing to get rid of his teeth was so strong that it overrode the pain that he felt with pulling out his teeth. So it was more painful to have that obsessive thought than it was to pull out his teeth. Mm-hmm. And he had no teeth, literally had no teeth. He was in his 20s. He pulled out all of his teeth with the pliers. So that's kind of an extreme example of OCD behavior, but that's how strong those obsessive thoughts can be. Other people I've seen that wash their hands continuously and their hands look like raw hamburger. You know, they just are raw and just really look horrible. So we do have to kind of be aware of how difficult this can be on their lives. So before we get into these other ones, I'm going to show you a little quick video on Howie Mandel. What do you think?
It must be nice being rich because of the stuff that he's able to do because he can pay people to do it that way. And
Exactly. That's true. Like all that new makeup every single day, right? I mean, who can afford
I was
that?
thinking of that. I was like,
Huh? The separate house? Yeah.
Separate house. Yeah.
Pretty wild, huh? Having a whole separate house. You're right, though other people aren't able to cope that way. So, but to me, in watching that, it doesn't seem like his OCD is really under good control, right?
Because he still has a fear of it. She won't touch anything.
Right, and it seems like with medication and therapy, he should be better than that. I mean, to me, that still seems pretty severe, unless he was worse and this is better. But wow, when I watch this, other people I know that have this disorder and with treatment actually are better than this. They're functioning much better. So, anything else?
I think it's excessive, but his wife like stuck by him, so that would be very difficult.
Yes.
To raise a family with someone who like
Can't figure out if
they probably never changed it up or never.
Exactly.
Never picked up their puke, never did any of the hearts.
Exactly. Right.
When it comes in handy.
Yes.
You have like help versus like a normal person. Like, can you?
Maybe she had help. Maybe she has. Well, she probably is housekeeper. I'm sure
Yeah.
she doesn't like do her own housework and stuff. So that would be obviously that'd be
You can't have somebody take care of their kid every time they get sick.
exactly right.
I
So
thought it was just
yeah.
hands, but then again, like the shoe touched his hands.
Uh-huh.
That's not even touching him.
right.
So
Yeah.
that bothered him so much,
Right. So that to me was like, wow, it doesn't sound like his disorder is under very good control. So I would think, have almost thought, well, what did you think about when the pill was on the floor? Like his only anxiety pill that he brought. You would have taken it? Blow it off, wipe it off with a paper towel. But I would almost think that could put you into a panic mode because that would be like your security blanket. In case you need it, you can take it. But if it's not available to you and you don't have any more pills, I would almost think that could precipitate like a panic level of
Why would
anxiety.
you just bring him a bottle of
Yeah, I was gonna say, why would you bring one if it was like that obsessive?
Don't
I would
know.
always want to back up if I was that scared.
That's right. That's a good thought. So, yeah,
Because then you have to go without it, and you already know how you are without it.
right.
That would give me anxiety on top of it. Like, okay, I dropped it.
Yes.
Now I have this
Yes.
coming, so now I'm
Yes.
more anxious.
Yes, you're absolutely right. And I think, Andrea, that you hit the nail on the head too with just how it does affect family members and relationships. And then you think too, what kind of a relationship is he having with his kids? You know, how his kids can't just like jump on his lap maybe or whatever, you know, and just do normal things if he's got the hand issue. So,
like hugging, kiss and all that.
Yeah.
I don't see like how.
well, you would think you think about how many germs there are in our mouths. You know,
Yes,
I would think there'd be more in your mouth than on your hands, but especially if you wash your hands. But
Yeah.
anyway, so it's not logical either then, right? I mean, some of those compulsive thoughts really aren't very logical. So there's other obsessive, besides obsessive compulsive, there's body dysmorphic disorder. These are all kind of related. Hoarding disorder, hair pulling, skin picking. So have you heard of body dysmorphic disorder at all? Do you know what that is? Andrea, you have? A couple of you have? Do you know somebody that has this? Like a famous person?
I can't think of anybody off the top of my head, but I know,
Okay.
you know, people are obsessed with either becoming super muscly. Like, I always think of like those bikini competitions where people
Uh-huh.
are very like
Yep.
muscly and then they spray tan.
Uh-huh.
Those kind of people.
Okay.
They can never.
They might have body dysmorphic disorder. They're never perfect enough type of thing. Okay. How about Michael Jackson?
Oh, yeah.
Do you think he might have had this? I don't know. I really can't diagnose somebody, but I could look at some of what he has done. And if you look at the pictures of him when he was a little kid to at the point like before he died, tremendous difference. Okay? Google it. Just look up, not right now if you don't want to, but Google it. Look up Michael Jackson and look at the change in his appearance over those many years. He was never happy with his appearance. He was never happy. I think mostly with his nose. Not happy with his nose and other facial features. And I think his skin also, because his skin became lighter and lighter over the years. And I thought he had some kind of disorder where he had patches, like his skin was, his tone was patchy, right? So he had that evened out. But then, if you look at his nose, wow. Over the years, how it changed. So people with that disorder, usually they focus on one part of their body that they're very unhappy with. And if you're rich, you can have multiple surgeries. Okay? Most people aren't going to be able to afford surgery, cosmetic surgery, because I don't think insurance covers that. If it's just something that is because you're unhappy with how you look, but you actually look perfectly fine. Insurance isn't going to cover that. So that's out of your pocket. So if you're rich, you can have multiple surgeries. But if you're not, then, you're kind of stuck with that. We had a patient who would come in with body dysmorphic disorder, and she would look in the mirror and she would see her face as being distorted and ugly and unlike other people's faces. But if you looked at her, she looked perfectly fine. There was absolutely nothing wrong with her facial features. She was just a very average looking person, but not beautiful, but certainly not ugly. And but she really felt like she was distorted and her facial features were unusual. But she didn't get surgery. So yes.
Do you think this is trending upwards due to like all the Photoshop and stuff in social media nowadays?
I would guess it would, because there's that ideal image of of perfection. So yes, I absolutely think there are society influences like that. And when we get to eating disorders, certainly that is another whole aspect. Yeah, for sure. Hoarding. I love watching those shows about hoarders. I just think it's fascinating. Isn't it? It's fascinating how people live and they have garbage piled up to here and they have to have a tunnel to get from. I just think it's fascinating. So that's, they're hoarding things that are really useless, nothing that they could ever use again, but they think they're going to use it at some point in time. They can't get rid of anything. My husband sometimes accuses me of this, but I really am not that bad. I do save things that are sentimental. Like I still have, probably from when my kids were born, all the cards that people sent me. I still have those, and things like that. But I'm really not a hoarder per se. But some people get to the point where they just can't get rid of everything. Actually, I think it's a little genetic too, because my mom and dad were kind of like that with saving things. But they were like World War II. They kind of went through World War II, and you were poor. When they were growing up, they were very poor, and so I think they just didn't throw things away. Because like when my parents passed away, we were kind of clearing out the house. I found like a bottle of mercurochrome in the medicine cabinet. that like was used on us kids when we were little, on scraped knees, has mercury in it. They don't sell that anymore. Can you imagine that? We put mercury on our, anyways. And they had things that were like, are you kidding me? I can't believe they saved all these things. Plastic containers. People just really can get very out of control to the point where they're in a dangerous living situation. Hair pulling and skin picking. Are you aware of any of those types of disorders? Yeah? Do you know of somebody that has that? Or
one of our residents, he just picks everything, and
okay.
we're supposed to monitor her behavior, but he won't let us put sleeves on or bandages on, and his arms are just all you can see all the scratch in him. Once he's got a scab,
Wow.
it's picking it off every single time.
Oh my gosh, wow. I know somebody who actually did that to their face. And their face was just all full of, scars. And originally she was telling people that it was a bad reaction to an antibiotic or something that she was on, because it was really noticeable. I mean, her face was just covered, with scabs and scars and blisters and all that sort of stuff. So it was kind of believable that she might have had some kind of a bad reaction. But then it came out later on. It came out that she finally decided to come forward with her OCD type tendencies and say, that it's basically she would be picking her own skin. And she said her family it got to the point where she was even using a razor blade to kind of pick at her skin. And she said her family would just beg her to get out of the bathroom and take razor blades away and hide them, because it was just, it really got out of control. So people that have that really need some help. And the hair pulling, people can actually pull their hair out. I know somebody that pulled out all their eyelashes and all their eyebrows, and big patches of hair can be missing, off of their head. So, yeah, just all related. They're all, all OCD type related disorders. So, kind of interesting. All right. Just a little response question. Patient complains of frustration with his impulse to use tissues to touch or grab anything and everything around me. I just feel clean and safe doing it that way. Sometimes I don't have a tissue. I can barely stand to open a door. So Howie Mandel was kind of a good example of that. So obviously they have an obsessive compulsive disorder. Another thing I just want to mention quick about that video is it's kind of nice when people that are famous kind of come out with whatever mental health issue they have, because I do think that it helps other people to feel inspired that, oh, Howie Mandel's got it, I have it too, there's hope for me, or it's not so odd or awkward. Because how did he feel? I mean, what did he kind of say when he first told Howard Stern?
Ruined his life and let his family down.
Exactly. He just felt embarrassed. He said embarrassed, I think, a couple times, right? Embarrassed, like he let everybody down, and oh my God, I'm horrified. I can't believe I let people know that I have this mental health issue. So I think that's why, because of stigma, that a lot of people feel that way. So if a famous person kind of comes out with saying that they have something, I do think that it makes people feel better, whether it's Howie Mandel or Brooke Shields, who came out with saying that she had postpartum depression. There's a lot of famous people that have bipolar disorder, so we'll kind of save that for when we talk about that. But anyways, so just basically we're going to be going through the whole assessment process. We're looking at symptoms, and we always have to do a self-assessment, because we may look at somebody with OCD and say, well, why don't they just stop washing their hands? But as you can see in the video, just get a little empathy that this is not something that they really control. So we have to look at our own kind of frustration level. So, and we just need to always do a thorough physical exam, make sure that we're not picking up on actual physical problems versus psychological, and determine if the anxiety is actually something that is inner driven, or if there is something physical going on with them, a physical issue causing that anxiety. So I think I'm going to probably stop here, and I'll let you guys go, and we'll continue on next week. So have a nice weekend. Stay warm.